The Omicron variant continues to dominate our daily COVID numbers, and unfortunately, it's starting to affect our children. Arkansas Children's Hospital says they've seen an increase in the number of kids with COVID in their hospital. THV 11's Ian Russell spoke with children's leadership about this, and he's joining us live tonight from the hospital with the latest. Ian.
Yeah, Marlisa, sad, unfortunate. It doesn't really matter how you put it. The idea is still the same. The staff here at Arkansas Children's don't want to see any kids sick with COVID-19, but as the majority of Central Arkansas students head back to the classroom this week, it's got health experts on edge about the possibility of another surge.
We expect the Omicron variant to be here and causing, significant infections throughout January, probably into early February.
It's a difficult situation at Arkansas Children's Hospital.
We're seeing a lot of kids with COVID in our outpatient clinics and ER. It hasn't driven hospitalizations to a large degree at this point.
Cases of kids with COVID are going up, and they're seeing it firsthand.
Our role in the state is to take care of every child that needs our services. We will meet that need.
But that's a tougher ask than normal right now. The Omicron variant is more contagious than what we've seen before, and even more concerning, students are back for the spring semester. There's no guarantee of a spike, but Dr. Richard Barr, Executive Vice President at Arkansas Children's, is still expecting one.
Pretty much. The Omicron variant is so contagious. It's so much more contagious than the Delta variant or other variants, as we knew it was going to be widespread.
Dr. Joel Tomlinson is the physician in outbreak response at the Arkansas Department of Health. He agrees with Dr. Barr. What we're seeing now with more kids catching COVID shouldn't be a surprise. It was going to happen.
Yeah, it shouldn't be surprising. And when we just have this many total cases in the state, well, there's no reason to think that kids can't catch it too, right? We know they can, and they do it just about at the same rate as adults, depending on their exposure risks.
So as kids head back to class this week, both doctors are offering up some advice. It's simple, but it's what works, they say. Wear a mask, social distance, and stay safe.
Kids need to be back in school for a whole host of reasons, but we can do it safely. And wearing a mask is one of the most important things.
Dr. Tomlinson with ADH says it's also time for parents to consider what their kids do at school. Are they wearing masks? Are they social distancing? As we get closer to the possible peak of this, he says those are going to be very important things to keep in mind. Live at Arkansas Children's, I'm Ian Russell, THV 11 News.